Well, not soon enough is here.
Yes. Hello, y'all.
Hello, hello, hello.
We are live for our Thursday short where we have all answers and no questions. So, on our Thursday shorts, this is our time to answer one question that we get from the audience. So, if you have a question that you would like us to answer on a Thursday short, send us an email at hello@ourblackutopia.com.
And you're probably looking at us right now saying, wait a minute, they're not in the same place.
We're not in the same place. We're not in the same place. I am pet sitting for a friend of mine. And so I'm here. Rick is there. And hopefully you can hear us okay because it feels kind of echoey in here.
It
But
does
let's get
sound
started.
good.
It's echoey, right?
Yeah, a little
Yeah.
bit.
Um, so, sweetheart, they say you get what you pay for,
Yeah, that's what we hear. You get what you pay for, but that's not always true.
right? And is especially not true, thank you, Shaquan, is especially not true when it comes to healthcare in the United States. You don't
No, because
get the
you,
biggest bang for the buck, right?
you pay a lot, but what do you pay a lot for? You know?
Exactly. Exactly. So today, it's nighttime here, y'all. It's 10 o'clock at night. That's how much we love you guys.
It's
It's 10
nice.
o'clock at night. So today we are going to talk about the differences between healthcare in the United States versus Portugal. We now have enough experience. We have our national healthcare number. And so we've experienced the costs and we've gone to enough of our doctor's appointments to give you a really good summary of what we've found in the healthcare system here in Portugal versus the healthcare system in the United States. And Rick and I have lived in a couple to three different states, so I'm sure it ain't that much different where you are,
Yeah,
right?
yes, I agree.
So why don't we introduce ourselves in case you're new to our channel? Hey, y'all. Welcome. My name's Halisi.
And I'm Rick. Welcome to our Black Utopia.
On our channel, we talk about money, travel, and retiring abroad as we build generational wealth, right? So we're talking about healthcare today. We're talking about the difference between healthcare in the United States and the healthcare in Portugal. But first, if you are new to our channel, then you might not know. About 7.5 years ago, Rick and I had a wake-up call as we were getting close to retirement age. We
Yes,
looked at our money and it looked funny.
it looks so funny. All you could do is laugh. Laugh so
Right?
hard you cried.
Laugh or cry.
You laugh
But
so hard you cried.
right? But about 3.5 years ago, we got our financial act together and we went from negative 22,000 to over 1.1 million in net worth. Y'all, if we can do it, you can do it too. So if any of that sounds interesting to you, please subscribe, hit that notification bell so that you know every single time we drop a new video or go live. And like this content if you do. If you don't like it, hit the down button. Let YouTube know what you like and what you want to be served. So we see you all. We see our family in the chat. Welcome, 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 our Black Utopia family. We love you
Hey,
guys. We're going to
everybody.
get started with a summary of the difference. So we're going to start with private insurance. United States versus Portugal.
Yeah.
So it works a lot different in the United States than it does here. And that's mainly because here in Portugal, they have true universal health care that is a public system that is run off of the tax dollars that citizens and residents pay. Taxes in Western Europe tend to be a bit higher than they are in the United States. And the reason is because they need to fund this healthcare system.
Hmm.
So private insurance in the US is kind of all encompassing. If you don't have health insurance in the United States, it's hard to get cost effective healthcare. And this is the thing. The insurance companies have held the medical profession hostage. by saying, we will feed you patients, and in return for that, you have to offer our clients a discount,
Mm-hmm.
right? And so there was a time when private health insurance was not a thing in the United States. Even when I was a kid, my family never used health insurance because going to the doctor was affordable. But after Reagan, that whole thing changed. And if you didn't have private insurance and you were not indigent, you were going to be paying through the nose for health care in the United
Yeah.
States.
I remember, and I might be telling my age here, but I remember when doctors used to make house calls, and the doctor that was actually uh, at my birth, Dr. Lee, he was a family friend, a family physician, and he was probably the only black doctor at the time where we lived. So it didn't break the bank to have to go to the doctor.
Exactly.
And they check on you and they come to your house and
Exactly.
check on you.
Exactly. So, what we're saying about the insurance system here in Portugal is probably similar in other Western European countries. And so, how it works here is the private healthcare system and private insurance works in conjunction with the public system. So if you have a cold or something like that, and you want it, or the flu, right, and you need an appointment, fast, private insurance, you get in just like you would in the United States in the next couple of days to a week or so. In the public system, that's not necessarily the case. Of course, they're overtaxed, and so you might have to wait a bit longer. So if you have a serious condition, if a person gets into an accident, or if they have cancer, or if they have something that is terminal or chronic, you're probably going to end. The private company is probably going to send you to the public system.
Mhm.
Um, that's how that works. And so, in general, private works as icing on the cake of the public system. Right, sweetheart? Anything else
Yes.
to add to that?
Yeah. Just like Michael had said, Michael from Serenity had said too, the public system, if you have to have a heart transplant, if you have to have major things done, and you are on the public system, it's no cost to you at all.
Right.
It's paid for by tax dollars and stuff like that. Private, you are covered under different things, but you have your percentage. If it's 80% that they pay for and 20% your cost, but it's still, to me, affordable. You
Yeah,
don't have to go broke.
exactly. And we'll talk about the cost differences next. Now, the public system here is very high quality. You get quality care in the public system.
Mhm.
So in the US, the public system is mainly for indigent folks, right? I mean, unless you live in a state that adopted expanded Medicare or Medicaid. Medicare is for seniors. Medicaid is for
Yes.
those folks who are lower income. So unless you live in a state that adopted the expanded Medicaid, Medicaid is basically for indigent. Like, you have to be in poverty to get low cost to no cost healthcare in the United States. Everybody who's in between, which is the majority of us, you SOL. And the other thing is what you find in the public system is that in the United States is that the quality is not what it is necessarily in the private system. There are a lot of public county hospitals, right,
Hmm.
that don't seem to be taken care of. The doctors seem to be way overworked, and the public system here, I'm sure the doctors are taxed, so they may be a bit overworked as well. But what you will not find necessarily is lesser care in the public system. You won't find dirty rooms and things like that, like we've seen in some of the county hospitals in the United States. They're especially here in Portugal, the public system are especially short-staffed in the smaller towns. So that's the public system. Emergency services like ambulance. Oh, we mentioned cost here. We're going to go ahead and mention the cost here because that's in our notes. I've never had to take an ambulance, y'all, but Rick has.
Yeah, I have.
And here's the thing. I remember watching a YouTube where this girl she was in England or something, and one of her and her girlfriends were out. One of the girlfriends, I don't know if she drank too much or what, or she got really sick. Food point, I don't know. But the friends, the UK friends were like, let's call an ambulance now. And the other American girl was like, no, wait. Let's just see, because she was thinking about how much it was going to cost this girl to be in the ambulance. So, Rick, how much does it cost to take an ambulance in general here in Portugal?
Cost for an ambulance ride in Portugal is anywhere from a whopping €5 to €20. Let me repeat that. €5 up to €20.
So we looked at the cost in Denver. The average cost to take an ambulance in Denver is $700. In LA, $1,800 to $2,500. Now,
Yeah.
if you're a teacher making $40,000 a year, getting after taxes, what, $33,000, $34,000 a year, $2,000 is a lot of money. $2,000 is a lot of money. So that gives you some differences in the emergency service. Now, unfortunately, again, here in Portugal, and especially in the smaller towns, there is a lack of paramedics. They need paramedics. They have been doing job searches and job, what do you call them? When you have a job fair
Job
to
fairs.
get to recruit paramedics, and they're still short about 1,000 paramedics here in the country. So that's one thing. If you are coming to Portugal, make note, it is not 911 to get emergency services. It's 211. So write that down. One of the other differences, I'm going to let Rick talk to this because he's the first one who found this out, and that's test results and follow-up, Portugal versus the United States.
Okay, so we have what is it, the HIPAA in the United States that protects you from your information from anybody obtaining it or sharing it. Well, the doctors here, and I found out
The hard
that
way.
that a doctor can order a test, and you go to the hospital, you receive the test, like it can be echocardiogram, it could be uh, what's the name of different tests that you have?
Even a blood test.
Blood tests, whatever type of test. You go, you have it done, and of course, the first thing you think is, well, it goes to the doctor's office contacts you, or the doctor themselves contact you, and say, hey, your test was blah blah blah. We can get together, go over it, whatever. That's not the case here. They don't do that. So the rule is, or the understanding is, in order for a doctor, even though they ordered a test on you, they don't have rights to your test. The hospital will send you copies of the record. They'll email copies of the record to you, and the hospital will have them, but they cannot give them to that doctor that ordered that test because they have no rights to them. The only way that doctor can view them is if you make another appointment, then they can access this, because that's giving them permission to access your health record to look and see and go over things. Because I sat here thinking that I had some tests done on me, And I'm sitting here thinking, okay, well, the doctor should be getting contact with me in a couple of days. And I didn't hear anything. So I contacted Serenity, who we're with, and asked that question. And I said, oh, no, they won't contact you. You have to set up another appointment with them that gives them permission to look at your test that they order
Yeah.
and
Yeah.
then proceed from there.
And so that's true, like with the mammogram that I got and the sonogram that I got. It wasn't until I made a follow-up appointment with the gynecologist where she looked at them and I had blood tests as well, and then went over them. And I'll tell you about that experience because y'all, I have never had an appointment like this in my life. And that's a good thing. So obviously in the United States, and I'm not sure if this is true for Canada, because they have universal healthcare as well. But usually, like, you get a mammogram at so-and-so clinic, like I can't remember what the name of the clinic was in Colorado. They ask for your gynecologist, or your primary care physician, and they look them up in the system, and then those results automatically go to your primary care physician or gynecologist. She then calls you, or a nurse probably from the office calls you and says, everything looks fine, we'll see you next year. And that's it. Here, I walked away from the laboratory with the pictures of the mammogram and sonogram, as well as my blood test in my hand. So I don't know what I'm looking at, but that's the difference between Portugal and US. So if you're just joining us, we're talking about healthcare differences between Portugal and the US. And we would venture to say that how it is in Portugal is probably pretty similar to how it is in other countries in Western Europe. All right, cost differences. Private insurance cost differences between Portugal and the United States.
Yeah.
So, sweetheart, how much do we pay? So last year, y'all know we were paying, anyone who's been watching us for a while, we were paying $1,800 per year for private insurance. Apparently, we were on a discount, and the discount lessens as you go. So this year, what are we going to be paying?
We'll be paying what? About 2,000 for the year.
Yeah, €2,000
for
a year.
both of us.
For both of us.
Yeah, that's not $2,000 a piece. That's $2,000 to cover both of us.
Which equals out to €167 per month. In dollars, that would be $2,160 per year, or $180 per month. And that is with being of a certain age and having pre-existing.
Yeah.
Here, it is not against the law to discriminate against pre-existing. Why? Because one, it was not against the law in the United States as well, even with no universal health care. But here there is universal health care. And so if it's not covered by private, you can always go to the public system. So each one of those is 80-20 in network. And that usually ends up being, for mine, like $25 copay per appointment.
Yeah.
So that's just about what we were paying in the United States. But now, we never had private insurance outside of an employer in the United States. But even, Rick working for a global employer in the United States, I kept track of this. Rick was like, it is what it is. No, it ain't is what it is. I want to know. And so I remember exactly how much we were paying, even though it was almost 2 years ago. And so 2 years ago, employer-based healthcare, we were paying $5,950 per year, or $487 per month. $487 per month versus $180 per month. And that was employer-based. So God only knows how much more money the employer was paying on top of the nearly $6,000 per year that we were paying. And even with that, we'll talk about the treatments. We still had to come out of pocket, not only for the copay, but for other stuff as well. So prescriptions. I'll talk about my prescription first.
Hmm.
Y'all know, look, y'all, I'm of a certain age. I am thankfully very healthy, but hot flashes, y'all, are no joke. And I couldn't handle them, and it was messing with my sleep, which can mess with your health, right? And so I have hormone therapy. I had hormone therapy in the United States and hormone therapy here in the US when I was trying to get some extra ones when we were traveling and we were still insured. They were like, no, you have to pay out of pocket. They're not going to give you any more than 30 days. I said, but I'm going to be gone longer than 30 days. Well, that's a you problem, not a us problem. So the cost at CVS for the hormone therapy that was prescribed to me without insurance was $180 per month. And then what was the one medication that you get here and there that we are
It's
comparing?
for the thyroid. It's hormones for your thyroid. I use Synthroid in the U.S. I switched from Synthroid to another hormone here, and for the Synthroid, I think I was paying what 100 and something dollars.
150.
Was it 150 for a 90-day supply?
No. Yeah, 150 for a 90-day supply. Yeah,
Okay, yeah.
150 for a 90-day
Um,
supply. And that was at CVS in Denver.
right, right, right. And here I pay pennies on a dollar pretty much.
It's
I
in the
mean,
note. €3, 90
three,
per
yeah,
month
€3
for a
90 cents.
for a 90-day supply. So $150 for a 90-day supply versus €3, 90, which equals about $4,
$4 or something. Yeah.
something like that, or 20 or 30, something like that. So that is the difference. Now here, as far as my hormone therapy goes, the difference is like there I had a patch. It was just a patch. And it was only customized in that she would say, put a new patch on every X amount of days. That's the only customization that I got. Here, they did a custom compound of creams,
Mm.
specially made for me, as well as prescribed vitamins and probiotics. And that's for this, and mine costs €77 and 16 cents, which is about $82 per month. So $180 per month for generic, anybody can take that, versus customized €77 and 16 cents, or about $82. Then I had a blood test done. And so now, based upon the results of my blood test, she has created my new prescription that may have changed. I know it changed just a little bit. She increased some stuff, decreased some other stuff. And so again, the custom made hormone therapy is €77 and 16 cents.
Mm.
Treatments. Let's talk about treatments. Um,
Good.
the last mammogram that I had in the United States, I thought I was still insured, but I wasn't. And so I had to pay out of pocket so as not to ding my credit. Sally Job, I think, is the clinic that I had mammogram done. It was $560 without insurance. And then you had a colonoscopy, sweetheart, in the U.
Colonoscopy, yeah, and my out of pocket was 1750, $1,750 out of pocket, which was supposed to be preventative, so it was supposed to be covered under
Obamacare.
Obamacare. But then they find something to charge you for. Okay.
Well, the treatment was covered, but the clinic time
The
was not
clinic
covered. And
time, the
office,
facility, the whatever. It was like, oh my
all
God.
these bills from all these different places. And at the end of the day, I was like, okay, I'm gonna put $5 down today. And then a month from now, we're gonna put $5 down more, right? I mean, it's just $1,750. Now, here in Portugal, sonograms are compulsory when you get a mammogram. So it's just that both of them together, they do, it's automatic. That's what they prescribe. That's what they do here. I never got a sonogram with a mammogram in the United States. The cost for the mammogram and the sonogram was €56.
Hmm.
€56 versus $560.
Yeah. Yeah.
What was your colonoscopy here, sweetheart?
So when I was in the States, of course, I came to my 5 year time to have my colonoscopy, and I kept getting the texts from my doctors in the United States in Colorado. And I kind of just ignored them because I knew we were returning back to Portugal. And I said, I'll just wait till I get to Portugal because I don't want to get stuck with another 17 to $2,000 to $3,000 bill. So my colonoscopy here in Portugal, my 5 year colonoscopy, cost me €348. And that
But you're
included everything. My out of pocket was €87.
So the insurance company picked up the rest of the money. But if we had no insurance, it would have been €348 or about $400 versus $1,750. And we're not necessarily going to the least expensive provider. We're going to the providers that Serenity suggests based upon our American expectations. I'm sure. Right. I mean, they don't have any kickback from the insurance companies. They just deal with a certain broker and they say these are the criteria for our clients, so they don't get any incentive to suggest one insurance company over the other. But their name is on the line when they make suggestions. So they make sure that the insurance companies that they suggest are the real deal, that they won't kick you off for nonsense, etc. There's always a less expensive insurance company out there, but you might not get what you expect. All right, now let's talk about the quality of the care. And I cannot say, I'm one of those people who I'm looking for a Black doctor in the United States. In the United States, I'm looking for a Black doctor for everything. General practitioner, gynecologist, dentist, all of them were Black. If I can't find someone Black, then I want to find a woman of color. If I can't find a woman of color, then at least a woman. That's my thing. Because I had white male doctors, and nope. So here, obviously, the relationship is not the same, and the type of racism is not the same. So, I just want a doctor who speaks English. That's why the bar has lowered to just please speak English. So the first thing is the amount of time that they spend with you. Do you want to go first, sweetheart?
No, you go. You go.
Okay. So I've had 3 appointments. This last one, this is after all of my test results and et cetera, et cetera. We were literally in there for 1 hour and 30 minutes. 1 hour and 30 minutes, just me and the doctor talking about everything about my health. When is the last time, besides being in a hospital, well, even when you're in the hospital and they make rounds, you don't get an hour and a half of the doctor's time. Only when you're delivering a baby will you get, or during surgery, will you get an hour and a half of the doctor's time. An hour and a half of the doctor's time. Not only did she talk about the specific reasons why I made the appointment, but she talked holistically about everything, about my eating pattern, about my exercise, about my mental health, spiritual health,
Yeah.
right? And how it all interrelates. And the key thing that I loved about what she said, and what she, like when we were talking about all of the different issues that I wanted to address, her first go to was diet, exercise, and vitamins, not drugs. She got my blood test results, which were 6 pages of printed results, 6 pages, literally went line by line and explained, this is what this is what it means in your body, and how it affects how you feel, or how it can affect your future self. And so I had 3 results out of the 6 pages that were either bad or borderline bad. And it wasn't like cholesterol or any of that, thank God. But it was like too much iron, not enough vitamin D, things like that. And so she prescribed new vitamins for me that had a higher amount of vitamin K, a higher amount of vitamin D3. And then she sent me to a nutritionist and someone for biofeedback. So the nutritionist looked at the blood test results, took my blood type, and created a list of foods that I should be eating on a regular basis. The only thing that I can say is I'm not happy about that, because now once you know, there's no excuse. There's no excuse.
Yeah.
So based upon my blood type, based upon my test results, her job was to help me change my diet so that I would not need as many multivitamins. So she gave me a list and said, these are the things that you want to eat more of. This, do not eat at night. This, only 2 times a week, et cetera, et cetera. And the bottom line is that I'm basically turning into a vegetarian. And she said people with my blood type should have less meat less animal product in their diet. I love me some ribs, y'all. I love me some ribs, so this is hard. But this is the difference. Like I've never, and this is all a part of the normal thing. I've never had this in the United States. Never, ever, ever. And then they did biofeedback, and I'd never had biofeedback. I'd heard the word. I know my mom had a book on biofeedback, but basically they put something around your head, and it's hooked up to a computer with software, and it basically sends frequencies to analyze everything in your body and to analyze future risks. And so then, based upon that, she did some things to try to reverse some of those things, and then she gives that information to the nutritionist, so the next time that I talk to her, there may be adjustments. That's healthcare in Portugal, y'all. Okay, Rick, what was your experience?
My experience with that, because I have I have 3 doctors actually. I have an endocrinologist uh, that I went to see because I wanted to establish a relationship with an endocrinologist here for thyroid, and then I have actually 2 primary care physicians. I have one that's at the hospital at COOF, and then Dr. Joao, who I just saw, and he ordered a lot of blood tests and urine analysis and stuff like that. So, and I always spend a good amount of time with the doctors. There's no rush. Nobody's rushing you out of the office. I mean, sometimes when you go there, because this is Portugal, y'all, so you got to pick a number, go to the machine, get your number, and wait till you're called. And usually within, I'd say, hour and a half, maybe less than that, I've been fortunate enough to go, and Coop, I believe, is a private hospital. I don't think it's
It is a
public.
private hospital.
Uh, but all my records and stuff, whatever I need to do, if I need to transfer information to another doctor and give them access to a doctor, I get copies of all the treatments. Like you said, you get copies of all the different things because they're your records. So they should be with you so you can go to your doctor and you can go over things with them or have records released to them or whatever. But so my experiences with doctors have been great. They are busy. They're very busy here.
But when I went to the doctor, when I went to COOF, so the difference is like my doctor is not in a hospital. They have a private practice, so there's no number taking. It works just like it works in the United States. You check in, you tell them you're here, and then you sit in the waiting room, and literally no more than 10 minutes, I'm in the doctor's office. But when I went to COOF with you, sweetheart, we didn't wait for an hour and a half. We waited for from the time of your appointment, we waited for 30 minutes.
30, yeah, I was going to say 30, 40 minutes. Then we did. Yeah. It's
Yeah,
usually not an hour wait for me. I've never
exactly.
really had an hour
And
wait. Even when I got my colonoscopy, it wasn't, I went in and it seems like boom, next thing you know, I was in and out.
exactly. And the other thing is that, I loved the way the doctor listened and talked about what she wanted to see, the test she wanted. And because I sat in with him because this was something that had been persisting and I wanted to get the information to y'all. I wanted to make sure he was asking all the questions. I'm a lot more forceful and proactive. And Rick, is a little bit more reserved when it comes to challenging doctors. And so I sat in well, not the exam part, but the talk part with him. And it was a good 30 minutes worth of talking before
Yeah.
she even examined you. And I know if I get in the United States, if I got 15 minutes with my doctor,
Oh yeah.
that was a lot.
That was
And
that was a good.
usually that was your annual thing. That wasn't the in-between things that happened, right?
Right.
Otherwise they're in and out. And the other thing is there's no what doesn't happen is the doctor's in there and then she puts you in a paper robe and then she goes to another room and you're just sitting there, doo-doo, and then maybe a nurse will come in and check your vitals and then you're sitting there, doo-doo, and then she comes back and she does a little something, something. Then she goes to another room and another room. That's not been our experience here. When it's your appointment, it's your time. They sit there with you without going to other rooms
No, they
and
don't.
hear what you have to say, figure out what the deal is, and then prescribe the treatment. I love the fact, Rick, that my doctor took such a holistic approach and that it wasn't just about drugging me, but it was about how can we change your lifestyle, your food, no more chocolate. How can we change your lifestyle so that you won't need any drugs in the future? And maybe we can lessen the amount of vitamins you have to take because it's happening in food. The other thing that she was talking about is, Halisi, this is what you need to do now to ensure that what is afflicting your parents will not afflict you. What can you be doing now to invest in future you? And this is not a money investment. This is a lifestyle investment. And so I appreciate that. I appreciate that. I appreciate that holistic approach. I appreciate the fact that there are natural ways to do this without saying drugs is the first stop.
But even on the whole the holistic thing and the eating thing, it doesn't break the bank in order to do that, in order to live that way, in order to enjoy the fruits and vegetables and everything. You don't have to break the bank to do that. It just
Exactly. Exactly. And so Jess asked, are we in separate rooms? And so, yeah,
we're in separate
in
we're
separate
in separate
homes.
places. Yeah,
I,
I'm at
I'm
home. Go on, babe.
Yeah, I'm pet sitting, y'all. I'm pet sitting, and so I am across town, and Rick is at our in our studio at our house. So, U.S. Healthcare versus Portugal. I have to say, I usually got quality care in the United States, but I remember this white male doctor saying to me two things. One is when I told him about a treatment that I had gotten at another place. And I told him how painful it was. And I asked him, was he going to have any local anesthetic or something? He's like, it shouldn't hurt. They did it wrong. And this was a treatment on, woman parts, not like generic parts that every human being has. Woman parts, right? It's like, well, how would you know? You ain't got these parts. So, but I trusted him because I was still in, like right out of college. He did the procedure and literally got the instrument stuck to the side of my uterus.
Oh, ouch.
You know how you put your tongue on a piece of ice and it sticks if your tongue is dry? It was that kind of thing. And it wasn't until my uterus thawed out that he could pull the instrument out. I was in so much pain with his arrogance. I was crying. The nurse was holding my hand. And then when I came back for the follow-up, he's like, you're here again? You women have so many health issues.
Yeah.
That's healthcare in the United States.
I
All
think.
right. So we are going to call it. We finally got this done. This has been scheduled for a long time. Those of you who have been utopians for a long time know that we've had this session scheduled, but I really thought it was important to wait until we got our health numbers so that we can say what the difference was. Rick wants to say one more thing.
No, I wanted to make one correction. So, and I believe you said the emergency number here in Portugal is 211 and it's 112.
Did I do a typo?
Yeah, I think you said it's 211 because you were saying 911, but it's not. It's 112.
Thank you, baby. Thank you. So I wrote it right, but then said it wrong. Yep. It said call 112 for emergency. Yep. So thank
I just wanted to clarify
that. I'm sorry, y'all. Move to Portugal Virtual Summit replays. They are still for sale. The information is in the description below. It's Christmas time, y'all. This is the Christmas season. Gift someone with the gift of financial independence, or gift yourself with the gift of financial independence. Our course, Beyond the Blame, Money Mindset Makeover for Financial Independence, after you take that, you will have an action plan to get you to financial independence as soon as possible. If we can do it, and even if you have no money saved, and you have debt, we will show you how you can get to financial independence ASAP.
You can do it.
You can do it, right? You can do it. And with that, on Sunday, we are going to be talking about our prep, what we're doing to prep for 2024. We want this to be our best year ever, and we want it to be your best year ever as well. More wealth.
Yes.
Better health. Right?
Yes. True.
All right. And our meetup for 2024 is June 17th and 18th. We are partnering again with Krishan of Blackset Global to do a joint meetup on the 17th and 18th. Tickets are going up, y'all, in a few weeks at the beginning of the year. So here's another gift you can give yourself. Discounted tickets are available at 2023 prices. That information is in the description below. And with that, we will see you on Sunday. We love you all. We see you all in the chat. We love the comments. And if you have a question, if you're watching from the future, hey, put your question in the comments. See ya.
See ya.